dizziness. So, if you've ever suffered from dizziness, it can be a bit overwhelming when it starts to hit you the first time, or it is possible that you have been researching about the cause of your dizziness and you might have come across like multiple causes, because dizziness is a very common symptom that is seen across a variety of conditions, including your cervical neck pain, whiplash injuries, if you have a weakness because of, say, iron deficiency or anemia, or if you have any eyesight problems, you have anything going on with your brain, any pathologies there. So it can be from a variety of problems, yeah, inner ear problems as well, like vertigo, etc. So, if today I'm going to talk to you about one of the commonest causes of dizziness that is seen nowadays, and especially if you suffer from neck pain, this is a video you want to watch, because dizziness is a very common, however, not very well known symptom of neck pain. So, today I'm going to give you a certain a couple of symptoms that go along with dizziness and neck pain. So, if you suffer from these, it's possibly that the dizziness is coming from your cervical spine. And if that is the case, you can discuss this better with your doctor once you have the knowledge of why and what is happening, what is giving rise to this dizziness, and you can just make more informed decisions about your health care. So now, before we jump into the topic, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage their joint and spinal pain, that is their back and neck pain. Now, these aches and pains might have started either, say, during your pregnancy, childbirth, or the later toddler years. Irrespective of when they started, they can take up a lot of your brain space and energy and interfere with your professional and personal life as a mom, as a professional. And it is not easy for us to take out a chunk of time and go research why and what is happening with your aches and pains and how you can manage them. Or maybe you've been researching about it, you've tried everything and nothing has really stuck. So this is where I come in and I give you simple exercises, easy lifestyle changes, easy tips and tricks that help you get along the way and manage your spinal, that is back and neck, and joint pains. All right, so let's look at one of the commonest one of the commonest reasons for your dizziness. So what is the cause of your dizziness? Now, as I said, there can be multiple causes, the common ones being whiplash injuries, inner ear problems, eyesight issues, anemia, etc. However, if you have neck pain, especially on your upper to mid cervical spine, and that is basically from your hairline down to about the middle of your neck and even lower down. So, first, let's address the upper to mid cervical spine. Now, there are nerves exiting our spine all the way from your hairline down to your tailbone on either sides. Now, these nerves supply specific areas of your body. So, the ones that are exiting the cervical spine or the neck area in the upper to mid cervical spine will go and supply the back of the head and then come to the front like this. So usually if you have a problem with the upper to mid cervical spine, it can lead to cervicogenic headaches. And the distribution of headaches is exactly with the area that I described to you right now, which can be one-sided or two-sided depending on which side of your spine is affected. And this can be accompanied by dizziness and plus minus nausea. So if you have these four symptoms of headache, neck pain or neck stiffness, nausea and dizziness, it sort of points towards your upper to mid cervical spine being the culprit. Now, what happens is whenever you have pain lower down in your, say, mid to lower cervical spine, so that's from the middle of your neck down to about here, if you draw a line straight from your shoulder lines. So there's a pointy bit in the middle, that's your junction of cervical and thoracic spine. So from the middle of the neck to that junction of cervicothoracic spine, that is that's your middle to lower cervical spine. Now, if there is a problem there, say cervical spondylosis, disc issues, or any problem that gives you pain and stiffness, say shoulder problems that are giving you pain and stiffness in your neck, even lower down in your mid to lower cervical spine, the muscles can cause a lot of tightness in the upper cervical spine, and this can initiate the headache and the dizziness in your um, causing sorry originating from your um, upper cervical spine. So basically, if you don't understand any of that, remember that there are nerves that are supplying the back of your head. These nerves, when they get pinched, you get symptoms like headache and dizziness. Most of the times these two symptoms are seen together, so if you have both of them, suspect that it's your neck that is causing your dizziness. um, if you want to know more about topics like your disc problems and cervical spondylosis and nerve pains, etc., you can go to my YouTube channel. That's where I've done a lot of videos on these. Or you can just go to YouTube, type my name, Swati Prakash, followed by cervical spondylosis or disc or nerve pains, and these videos will come up and you can have a look at the details there. But this is what I wanted to address today. It's one of the commonest causes of of your dizziness is your cervical spine. Now, if you're looking for more details on inner ear problems, I have done some blogs on that. If you go to my website, you can have a look at those blogs as well. Now, as I said, there are many other causes of dizziness. If you're looking for more detailed symptoms of these causes, I will leave a link in the description of this video. And if you're watching me on Instagram, the link is in my bio. You can go to that link and you can click on it, and it'll give you a page. You can have a look at the causes for your dizziness there. Alrighty, if you have any questions or any comments on the video today, do let me know and I will try my best to answer them for you. If you have any topics that you want me to address and they are in the scope of my knowledge, I will definitely do that. So make sure you leave those comments below the video. Alrighty, I'll see you guys next time. Bye for now.